Hello, everyone. My name is Nario Cantu, and thank you for tuning in for the Friendly Pharmacist podcast, starting now. Hello, listeners. Welcome back to the Friendly Pharmacist podcast. I'm your host, Nario Cantu from Cantu's Pharmacy, where we always strive to bring you fresh, relevant conversations on health and wellness. Today, we're diving into a topic that impacts us all, but doesn't always get the spotlight in healthcare discussions: climate change and its impact on public health. We hear about climate change in terms of rising temperatures, melting glaciers, and extreme weather events. But what does this mean for our health and the communities we serve? Let's explore the hidden connections between climate change and public health, touching on heat-related illnesses, vector-borne diseases, and environmental health risks. First, the heat is on. Heat-related illnesses. As temperatures rise globally, heat waves are becoming more frequent and intense. For those working outside or without access to air conditioning, this isn't just uncomfortable. It's dangerous. Heat-related illnesses such as heat exhaustion and heat stroke can have deadly consequences. At our pharmacy, we've seen how vulnerable populations like the elderly and children and those with chronic health conditions struggle during these extreme weather events. But the good news is that awareness can save lives. Simple measures like staying hydrated, avoiding peak sun hours, and checking on neighbors can make a huge difference. Let's not forget the importance of community preparedness. Pharmacies like ours can play a role in providing resources, distributing cooling aids, and educating the public on recognizing the signs of heat-related illnesses. Next, creepy crawlers. Vector-borne diseases on the rise. Now, let's talk about those tiny carriers of big problems, mosquitoes and ticks. With warming climates, these pests are expanding their reach into regions where they weren't a concern before. Diseases like West Nile virus, Zika, Lyme disease, and even malaria are creeping into areas that were once too cold for their survival. This means that even here in the U.S., we need to stay vigilant. As healthcare providers, pharmacists are on the front lines of prevention. Stocking insect repellents, sharing tips for bite prevention, and educating patients on early warning signs are just a few ways we can help. A personal example from my own pharmacy. Last summer, we saw an increase in questions about Lyme disease after an unusually mild winter. It's not just anecdotal, it's a trend backed by science. How about environmental health risks from air to water? Lastly, we can't ignore the ripple effects of climate change on the very basics of life, air, and water. Wildfires, worsened by drought and high temperatures, contribute to air pollution, which can exacerbate respiratory conditions like asthma and COPD. Meanwhile, floods and hurricanes can contaminate water supplies, leading to outbreaks of waterborne illnesses. Think about how pharmacies can act as hubs during such crises. Whether it's ensuring patients have access to critical medications during a disaster or providing masks for poor air quality days, we play a crucial role in community resilience. And as individuals, we can all take small steps to reduce our carbon footprint, because healthier environments mean healthier people. Climate change may feel like a massive, unstoppable force, but the truth is, there's so much we can do. From educating ourselves and our communities to advocating for public health policies, every action counts. At our pharmacy, we're committed to staying informed and helping our patients adapt to these new health challenges. Remember, the more we know, the better prepared we can be. Thank you for tuning into the Friendly Pharmacist podcast. If you have any questions or want to share your own thoughts on today's topic, drop us a message or visit us in person. Together, we can face these challenges and protect our health and the health of future generations. Until next time, stay safe, stay informed, and take care of one another.